Thank you, Chairman Altman, for the kind introduction and for the invitation to speak at this year's Cost Trends hearing. Thank you to your colleagues on the Commission, as well as Executive Director Seltz and the staff at the HPC. I also want to take a moment to acknowledge and thank our doctors, nurses, CNAs, home health aides, administrators, and so many others, our entire healthcare workforce across this great state, who have made such enormous sacrifices over the past 20 months while providing world-class care to our residents. You've cared for countless patients and their families with skill, with empathy. You've comforted the sick and the dying, and tragically have mourned colleagues. You've borne immense physical and emotional burdens from the front lines of this pandemic. Were we not in the position of having so many wonderful providers and a workforce that we have here in Massachusetts, so many other lives would be lost. And I am personally extraordinarily grateful for all that you and your organizations, your institutions have done and continue to do. It was really remarkable to see the collaboration and all the work that was done together. I thank you, and the Commonwealth thanks you. We also need to take a moment to acknowledge those who've been operating under enormous strain since the start of this pandemic. I referred to the workforce. I do want to acknowledge the hospitals and academic medical centers. Even as COVID cases seem to be receding, other effects of the pandemic continue to strain our institutional providers. And again, I want to thank those providers, our hospitals and AMCs, for all of their collaboration and all of the work that was done from the early days of this terrible pandemic all the way through. I want to thank as well community health centers and others who partnered with hospitals to deliver care, whether it was the early days of testing, later on the vaccine, the addressing issues of food insecurity, housing insecurity. You stepped up, all of you, big time, and we are grateful. And as I say, you saved lives and made the health and well-being of our communities and families that much better. Here in Massachusetts, we are so proud to have the highest quality healthcare providers, the most innovative payers, the smartest health policy thinkers, and a life sciences sector that developed a safe and effective COVID-19 vaccine. Yet, as we enter this 20th month, the COVID pandemic continues to shine a bright light on the inequity and the racial injustice in our society, and on the imbalances that exist in our healthcare system. Today, I know, you know, our healthcare system is under incredible stress, and it's at an inflection point. All of us in healthcare and government and community, we need to come together and develop solutions to the imbalances and the inequities. And that's why I'm glad we have this forum to come together as a healthcare community, bring forward the best ideas to confront the challenges before us. And I mean that. I know this is an immensely challenging time. It's an immensely challenging issue. We're here to talk about cost containment, but it's also clear now more than ever that we actually desperately need more investments in certain things, specifically in our behavioral health system and in the healthcare safety net. Every day, I hear from people from all walks of life, from all across the state, who can't get access to the behavioral health that they need for themselves or for a family member. Patients who need outpatient therapy are waiting months for an appointment with a therapist who takes their insurance if they can find one at all. Inpatient behavioral health beds are unavailable because hospitals can't staff them. A lot of people are left in crisis, including adolescents in our emergency departments and boarding and inpatient medical service beds, just waiting for an appropriate placement to open up. Staff in the ER and medical wards care for these patients, but they can't offer the treatment that they need. Meanwhile, other patients who need medical and surgical care are forced to delay treatment. This tragedy that's unfolding in our healthcare system, especially in our behavioral healthcare system, but extending far beyond it, is inefficient and expensive. And more importantly, it's failing our residents who need care. It's exhausting our healthcare providers who've already been pushed to the limit. At the same time, supporting access to care for underserved communities has never been more urgent and calls out for a more, not less, investment. Safety net hospitals in our gateway cities and elsewhere who serve higher proportions of Black and Brown residents face extraordinary challenges in keeping their doors open, attracting and retaining experienced and dedicated staff, making the capital investments necessary to acquire, develop, and maintain buildings, medical equipment, and electronic health record systems. But let me be clear, even though we need more money to address dire needs in behavioral health and health equity, we can't afford to pay more for healthcare. People continue to really struggle. I hear from Massachusetts families who can't afford to keep up with rising health insurance premiums and high deductibles. I hear from small business owners who are struggling to stay afloat after COVID, and at the same time, working to keep health insurance affordable for themselves and their employees. And as HPC staff have reported, on average, the annual health insurance premium for a Massachusetts family is more than $22,000, the price of a new car. So what do we do to address this problem? First, I want to acknowledge and applaud the significant investments proposed by both the House and the Senate in behavioral health and in the financial support for providers who serve our most vulnerable communities. And as we think about the future and about how to respond to the systemic challenges we face, we can take a moment to reflect on what has brought us to today. It was almost a decade ago we passed that landmark law here in Massachusetts. It was a law founded on the idea that our state could rein in healthcare costs by transforming care delivery, by establishing annual growth benchmarks, and by requiring cost and market impact reviews for major transactions, overall bringing more transparency to the marketplace. It was a groundbreaking legislative accomplishment. It was propelled by countless conversations across providers and payers and community organizations, businesses, legislators, and others. I know that there are many in this virtual hearing today who played key roles in the creation of the law. We've accomplished a great deal, yet we find that costs continue to rise and that healthcare cost growth continues to exceed our state benchmark. Now, we've got more data than ever before on healthcare prices, but patients aren't moving, it seems, to lower priced healthcare providers. And high-priced hospital systems are proposing major expansion projects that will likely increase their commercial market share at the expense of lower-priced providers. The HPC has presented a set of recommendations in its recent cost trends report that I hope will renew the important conversations around healthcare costs, about how to address the urgent needs for investments in behavioral health and health equity without sending the bill to workers and families through increased premiums or higher deductibles. We need to think differently about government tools for cost containment and redistribution of healthcare dollars. These changes will be hard for some, but we can't afford to continue the way our healthcare spending has been going. Our new normal must be one founded on equity and access, which means controlling costs more effectively and directing investment where we need it most. Count me in as an ally in the difficult and important work ahead, and thank you to all in our healthcare space for what you do.